Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the clinical anatomy of the tennis elbow and golfer's elbow. What is tennis elbow? Tennis elbow is the inflammation of the lateral epicondyle of the humerus due to repetitive use of the superficial extensor muscles of the forearm. The superficial extensor muscles of the forearm originate from the lateral epicondyle from here, site of origin of the superficial extensor muscle. So repetitive use of this muscle will cause inflammation of the lateral epicondyle plus inflammation of the periosteum around the lateral epicondyle, and that will lead to a clinical condition. We call it tennis elbow, that is typically seen in a tennis player. Okay, but we have a lot of other occupation that also use this joint, like that of the carpenter or plumber or weightlifter. They may have also tennis elbow like feature. Regarding golfer's elbow, again inflammation of the medial epicondyle of the humerus due to repetitive use of the superficial flexor muscles of the forearm. The superficial flexor muscles take origin from the medial epicondyle of the humerus. This is the medial epicondyle of the humerus. So it may be inflamed, its periosteum may be inflamed due to repetitive use of the superficial flexor muscles of the forearm, and clinical condition is called golfer's elbow because it is seen typically in the golfers. But any other occupation that uses this epicondyle and due to repetitive movement and inflammation, that is also the part of the or also the features of the golfer's elbow. Okay, so tennis elbow, pain over the lateral epicondyle, usually in the lateral epicondyle, but it may go down. There is lateral epicondylitis, inflammation of the lateral epicondyle. This is the lateral epicondyle. Muscles taking origin from the lateral epicondyle by a common extensor origin are the extensor carpi radialis brevis. Okay, so we have the extensor carpi radialis brevis here. Then we have the extensor digitorum here. This is the extensor digitorum. Okay. Okay. So extensor carpi radialis brevis, extensor digitorum, then the extensor digiti minimi, then extensor carpi ulnaris. Okay, so these are the muscles which have common extensor origin from the lateral epicondyle. From lateral epicondyle, we're also getting the origin of the anconeus muscle. There is a weak extensor of the elbow joint. Plus, we have the extensor carpi radialis longus. Part of it also take origin from the common extensor tendon. Okay. The brachioradialis usually come out of the lateral supracondylar ridge area, not from the common extensor tendon. So the tennis elbow, we have a differential diagnosis. There is the radial tunnel syndrome. The radial nerve is compressed between the superficial and deep head of the supinator muscle. That may happen, and that may mimic the features of tennis elbow, but here pain is usually distal and there may be muscle weakness on the distal part, the muscle supplied by the deep branch of the radial nerve. Okay, golfer's elbow due to the medial epicondylitis, due to overuse of muscles having common flexor origin. Okay, the superficial muscles of the front of the forearm. Okay, so These are the muscles. These are the superficial muscle from the medial epicondyle, like that of the pronator teres, flexor carpi radialis, palmaris longus, then the flexor digitorum superficialis, then the flexor carpi ulnaris muscle. Okay, these are the superficial muscles of the front of the arm, and they are taking origin from the medial epicondyle. Overuse of this pronation. So pronation. Okay, flexion of carpi radialis, flexor carpi radialis, palmaris longus. This all flexes the wrist joint. Okay, also partly the elbow joint. Okay, so that will lead to golfer's elbow, typically seen in the golfers. Okay, how can you diagnose? Diagnosis by the physical examination of the patient, clinical examination, history, then certainly the X-ray, ultrasonography. Treatment, it should be treated by the registered physician or licensed physician. How they treat this type of patient: rest, change of occupation if possible, physical therapy, cold compression. Usually the physical therapist give us some idea about how to do what type of physical examinations, the physical exercise should be done. They also advise to put the ice on the elbow so that there will be decrease in pain. Analgesic, it may be non-steroidal anti-inflammatory drug like Advil, okay, or ibuprofen. Okay, steroid injection, it may be blindly given on the epicondyle area, or may be given under the ultrasonographic guidance. The best management by injection of patient's own platelet-rich plasma. Okay, that will give us injection of 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 patient's own platelet-rich plasma. That should be the management of choice, and it will good healing. Please read this OF of. Okay, and last of all, if everything is failing, then there may be surgery, but surgery may not be 100% curative. It may not be always successful. You have to remember that part. Okay, so we got that, and that's all about the golfer's elbow and the tennis elbow. If you have any question, please feel free to ask me, and please share the information with your friends, and have a nice day. Please support my channel. Please subscribe me. Bye now.